Hello, I am Gerald Ababa Bisara from BSN 212K, and today I am going to perform a female urinary catheterization return demonstration. So urinary catheterization is the insertion of a flexible tube or the catheter through the urethra into the bladder to empty it from urine. Catheterization reduces the risk of infection and kidney damage by making sure that the bladder is empty either continuously or at regular intervals. Urinary catheterization is usually used when people are having difficulty urinating, natural relief, or this could also be used before after surgery when necessary. And also catheterization is also to help in performing certain tasks. So now, prior to conduct of the procedure, I have checked the doctor's order for catheterization. This is done to ensure that I have the right patient and right procedure to be done. Next, I have performed hand washing to deter the spread of microorganisms that cause disease and contamination. After that, I have already prepared the necessary equipments, which saves us time and energy, and this includes two-way Foley catheter, urinary bag, catheterization set, 10 cc syringe, draw sheet, betadine, forceps, and of course, the lubricant. So after that, after fixing everything, let's go and meet our client. Good day, ma'am. My name is Gerald Ababa Bisara from BSN 212K, your student nurse for today. And for your verification, can I have your wristband, please? Can you please state me your full name? Okay, Libeth Alba. Thank you so much. How about your birthday? Okay, October 7, 2003. Okay, thank you so much. So how do you want me to call you? Lilibeth. Okay, Lilibeth, what language and dialect do you prefer? Okay, English. Thank you so much. So now we are going to explain the procedure to the patient so that the patient will be well aware of the whole procedure and also for them to cooperate well. All right, Lilibeth, we understand that you are having difficulty urinating, and so your Dr. Santos, has ordered for you to have a urinary catheter. So what I am going to do is to insert a tube through your urethra and connect it to your bladder so that you can excrete your urine. Okay? So later, during the procedure, I am going to expose your genital area. And you might feel a little uncomfortable during the procedure, but afterwards, you should feel relief. Will that be all right? If Do you have any clarifications or questions? Okay, thank you. So before we begin, we need to close the door and curtains so that no one from outside will be able to disturb while we are doing the procedure, and also to provide patients privacy and comfort. Okay, so ma'am, are you comfortable with that? Okay. Now, position the patient in dorsal recumbent with knees flex. This is done to provide good visualization of the meatus where we will be introducing the catheter. Also, the gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. Okay, so can you please do a dorsal recumbent position for me, ma'am? Okay, that's great. Next thing that I am going to do is to secure the urinary bag on the patient's bed frame. So the urinary catheter should be below the waist level of the patient. So since that my catheter is on the packaging, let's set aside that because we will arrange that later and put it all into our sterile set of materials. The next thing that I am going to do is to drape the patient, exposing only the area to be used. This is done to avoid the patient from getting embarrassed and having chills, which causes tension and which may interfere with the easy insertion of the catheter. So since that my patient has already draped herself using her blanket, so all we need to do is to ask our patient her permission if we can show or we can expose her genitals. Ma'am, Lilibeth, can I expose your genital area, ma'am? Thank you so much. So let us expose our patient's genital. Okay, thank you. Okay, So after that, I am going to place a bed pad underneath so that our bed will be protected with dirt and soil. Ma'am, can you please lift your buttocks for me? Okay, thank you for lifting your buttocks. All right, so now provide direct light for the visualization of the genital area. Next is I am going to open my tray set and arrange the equipment accordingly for convenience and to maintain sterility. Okay, so after doing that, I am going to use my sterile forceps to pick up some cotton balls, soak in a cleansing solution or betadine, and clean the genital area of the patient. Now, this is the other forceps. And we should not forget our kidney basin so that we can throw our cotton swabs or our contaminated cotton swabs on it. So let's place it into the bed pad. Now, thorough cleansing of the meatus and surrounding it reduces possible introduction of microorganisms in the bladder. So first, let's lie down and discard. Discard. Next is I am going to use another cotton ball for the labia majora. Remember that never retrace a stroke to ensure that we do not contaminate the cleansed area. Start. Now, let's proceed to the labia minora and then labia minora into the opposite side. Start. Now we are going to open the set. So inside my preset, I have an eye sheet, sterile gloves, sterile cotton balls with cleansing solution, and I have a pre-filled syringe that contains 10 cc of sterile water, which I am going to use to inflate the balloon of the urinary catheter. So I also have sterile forceps and lubricant. So I've already opened the sterile set earlier. Now I am going to add my catheter and also my urine bag into the set. Okay, so never ever touch the actual catheter and the actual urine bag to avoid contamination. It's okay if the catheter will fall in here because all of this is sterile. And now our catheter, using the forceps, maybe. Then throw the trash. So after doing that, I am going to perform hand hygiene and I am going to don my gloves to deter the spread of microorganisms and also to avoid contamination. Now using the forceps, pick up the gloves and after pick upping your gloves, don your hands. Okay, so after donning my gloves, I'm going to get my eye sheet and place it on my patient. Now I am going to connect the catheter with a pre-filled syringe and lubricate the catheter for about 1.5 inches. This is done to reduce discomfort and friction, which in turn will reduce pain upon insertion, infection, and dilation of the urethra. Checking if it's really 10 cc. Insert. Then after inserting, lubricate. So here in my tray, I am going to pick up the catheter with one hand and place it on the other side of the, or pick up in the other hand on the labia minora of the patient, separating the area surrounding the meatus. So I am going to insert the urinary catheter. So let's just put it there. So I will going to separate the labia minora and then pull up so we can properly see the opening. So let's insert. Okay, so let's insert properly and check. Okay, so kindly please relax, ma'am. Thank you so much. So now insert the urinary catheter about 2 to 3 inches. So I insert the urinary catheter earlier into 2 to 3 inches. So relaxation of the external sphincter aids in the easy insertion of the catheter. So insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. So female urethra is approximately 1.5 to 2.5 inches. Now, if a specimen needs to be collected, pinch the catheter because the urine will flow out if the lumen is not occluded, and place the specimen container in place. So now, rest the hand of the patient pubis while holding the catheter in place to avoid pushing and pulling the catheter, because withdrawing and pushing the catheter back in the urethra may cause an infection of the urethra. The next thing that I am going to do is to connect the catheter with the urine bag, making sure that the urine bag is closed to avoid the leakage and maintain the sterility of the connection. Okay. So we can just grab our other hand. Pull. Okay. Flex. Using one hand. Properly tuck it. Okay, it's properly tucked. Next thing to do is to inflate the balloon with a 10 to 15 cc sterile water, so the balloon will prevent the catheter from splitting out the patient's body, and also when the catheter needs to remove, then the balloon will be deflated. Okay. Okay. All right. So let's put it here. Now I am going to secure the indwelling catheter by taping the catheter into the patient's thigh. So for females, the thigh is the best area to tape the catheter, and for males, it would be the abdomen. Also, provide some slack to accommodate the patient's movement. So after that, remove the eye sheets. So let's place it first into our patient's thigh. Okay. Then tape it. Assuming that I tape it. So now we're done. We're done on the procedure. So now let's remove the eye sheet. Okay, that's it. And throw it into the proper receptacle. So now we're done, ma'am, and I'm just going to cover you up to provide you comfort, and I am going to take this bag below you. Then I am going to remove my gloves now. So I will just first remove my gloves so that your bed sheets or your linens will not be contaminated. So properly discard the glove. And then okay. Are you comfortable with that, ma'am? Thank you so much. So how are you feeling, ma'am? Are you okay? Are you good? Is it hurt or not? Or it hurts or not? Okay, thank you. So after doing the procedure, perform aftercare of the equipment used and perform hand washing, and also document the procedure or document the procedure if it's done. So for documentation of the urinary catheterization, I will tell it or I will tell you later if I will go back to my station. Okay, so first let's do an aftercare with the materials. Okay. And we're done. So for the documentation of the urinary catheterization, always include the date and time of the procedure, the type and size of the catheter used. So I use a two-way Foley catheter, latex silicone coated. Its size is a 14 French. Also record the amount of fluid used to inflate the balloon. So I use 10 cc of sterile water, and also document the character and the amount of urine, the reaction and response of the patient, and include the other significant observations. And that's it. That's the end of my return demonstration of catheterization. Thank you for watching.